Hello, everyone. I'm the Psych MDS nurse, and I hope you enjoy my videos. I really enjoy doing them. And so today we're going to talk about delirium and the dilemma that it causes. So we're going to talk today about a couple things relating to delirium and try to connect the dots here. We're going to start with coding the symptoms in the MDS. So at the bottom of section C, there is the CAMS assessment, which is looking for signs and symptoms of delirium. So this is an assessment for symptoms. It doesn't diagnose, although it can be related to other diagnoses. So you don't code based on what you think should be present, but what symptoms the resident is actually displaying in the 7-day look back period. And any symptoms here is going to trigger CA number 1. CA number 1, or care area assessment number 1, is going to prompt you to write that CA note, the care area assessment note for delirium. And in this note, among other things, you want to include anything that is going to be placing the resident at risk for delirium. So these are things listed here. They can be diagnoses, medications, infections we all know contribute, but there's many other things. So every time there's risk for delirium, you want to assess what is going on with that resident. You may have noticed that section C of the MDS is not going to capture every symptom that is or can be related to delirium. So you want to make sure you're looking for other symptoms as well. And these might be on other areas of the MDS, or they might be not on the MDS at all. So those things you want to add into your care area assessment note as well, and make sure you do a full assessment of the resident. Speaking of a full assessment, there's a lot of medical or psychological things that could be contributing to delirium, and you want to continually be thoroughly assessing for every possible thing that could be contributing. You want to start with least invasive and work towards more invasive if needed, including the brain imaging. So once you've identified the symptoms and the causes, you can form your treatment plan, which is going to be targeted at the causes. Things you want to include are promoting sleep, good nutrition, hydration, monitoring labs. Studies have shown that connections with family and friends can be helpful and very grounding for patients. You also want to, use medications when appropriate and treat infections. So then when it comes to completing your care plan, you're going to start with your CA note where you have all your contributing factors and symptoms all documented. And you are going to kind of connect the dots to the interventions and treatments that you chose so that anyone looking at your documentation can come to the same conclusions that you did and agree with your treatment plan. Thank you guys so much for watching. And please let me know if you have any other questions or if you have any other topics that you'd like to see a video on.